It's about 10 o'clock. Welcome back for those of you who are returning, and we're glad that for anybody new who's on this Zoom chat, we'll give it another minute or two and then we'll start. You're supposed to mute your microphones and also make sure that your video is not on. That's the technical way of saying turn everything off. So Juliana, I think you can see, there she is. Ospina, Cano, I've been working on that all morning. She is the executive director of Conexion Americas, and she is going to be talking to us today for the next hour. So Juliana, the way this normally works is we give it another minute, but then we go ahead and start talking, and then we welcome everybody formally. So how you doing this morning?
I am doing well, thank you. And it's great to see some familiar names here. So thank you for joining us this morning. And
I'm looking around, exactly where are you right now?
I am at Conexion Americas. There are only two people this morning here, myself and Carla Reese, one of our amazing chefs that is using Mesa Comal this morning to cook and prep food.
All right, so your office looks fairly clean, that's good. And before we get started, I asked you this question before. As you talk, you will have this big thing on your finger. It's on your right hand. What is it? There it is. It is a piece of wood that I thought was a splinter or a bandage. It's really a ring, correct?
It's a ring, yes.
Yeah, okay, and what's the story behind the ring?
Yes, so I don't know how many of you, but my family and I came from Colombia when I was 15 years old, and we didn't come with much, and I didn't bring a lot of jewelry, and I like chunky jewelry, and this was one of the pieces of jewelry that I brought. It's made out of wood, and I really, really like it, and I wear it almost every day.
Yes. Very good. Okay, you can keep
it's
it on.
Distracting, yes.
It's very distracting, so I just was letting people know what it was. So Juliana Ospina Cano is the executive director of Conexion Americas, and we will start. So Juliana, you've been at Conexion Americas for all of 9.5 months, right? But you were here before. You were in Nashville before, and then you went to Washington. So just for people who don't know you, just and we only have an hour, so just briefly, like, take about a minute or two, and just so you're originally from Colombia, correct?
Mm-hmm.
Okay. And how did you get to Nashville?
Yeah, it's a great question. So originally born and raised in Colombia, but my mom's side of the family has been in the U.S. since the 1960s. They came to California, and they have been there since 67. And the other side of my family is in Vancouver, Canada. So even though I was born and raised in Colombia, I've had family and connections in North America. But in 2000, prior to the big migration from South America, as a result of the political situation and the economic disruptions in the city and in the country where I was born in Colombia, my family made the difficult decision to come to the United States. And we came and we got here to Atlanta, Georgia. And I went to high school. I went to 4 different high schools. So the experience of the kiddos that we meet here at Conexion Americas is very similar to mine. And I went to college in Atlanta, in Georgia. And I was there for 10 years. And then after college, after working at Newcomer Center, I moved to Nashville. And I loved it. I lived here for 4.5 years. I worked at Conexion Americas, at the Office of English Learners as well, and then at STEM Prep Academy. And then I moved to DC, but we'll talk about that later. But I always knew I was going to come back to Nashville. I loved it. I just never in my wildest dreams imagined that I would come back as the executive director of an organization that I love so, so much.
So I don't detect a Southern accent, but did you grow up in Atlanta?
Yes.
I know you went to high school there. So you went to 4 high schools in Atlanta?
Yes,
That right?
yes. And it's, I don't know if it's the English learner in me, but I pick up accents. So it depends on who I'm spending time with. Sometimes my Spanish accent is quite strong, and sometimes I have that Southern thing. But no, it depends. I do say y'all a lot. Good morning,
Very
y'all.
good.
That's
Okay. Then
yes,
that
yes.
that's good. All right. So I'm not you know, you always kind of assume that people know what Conexion Americas does, but just in case we have some people on that don't, again, just briefly, not during a pandemic, because that's the next question, but what does Conexion Americas do? What
Yeah,
does it typically do for, what does it do for people, or does, I think I said it wrong.
absolutely.
Tell us a little bit about it.
Yes, this is wonderful, and I see that Abby joined us. So, Conexión Americas is a local nonprofit. We're based here in Nashville, Tennessee, but we reach families all across the state. We serve about 10,000 families on an annual basis, and our focus is to uplift immigrant origin families and really work to make sure that all individuals have a place where they can belong, contribute, and succeed, from civic engagement to education programs, to economic entrepreneurship and opportunities for all families. We're rooted here at Casa Azafran, where we have the collaborative, beautiful space where we have other nonprofit organizations that work alongside us. And again, it's truly an honor, because even we've been doing this work for 18 years, in times like today, our track record allows us to shift and provide services for families so they can tell us how can we continue serving under very difficult circumstances.
Okay, so it's tough enough as it is, but let's just get right into it. Okay, so I was looking at the mayor's numbers this morning. 2,875 confirmed cases in Davidson County. That's an increase from 43 from yesterday. 27 deaths. Our numbers have been kind of fluctuating. I know he extended his safer at home to May the 8th. From a council standpoint, we got the mayor's budget this week. A dollar property tax increase proposed. I mean, so there's a lot of frustration, a lot of anger out there, and a lot of fears. And so your organization is right in the middle of it. So what are you seeing? What's happening out at Conexion, and what do people need to know about the immigrant population? And basically, you know, what are you hearing and what are you seeing out there?
Yeah, so before I go into some data, and I was looking at some numbers because I wanted to provide a very specific snapshot of what we're seeing. I just want to take a step back that since I arrived and now leading up until January and February, the national and the federal narrative had been sending very strong messages to the Latino and immigrant community, right? Messages of fear related to public charge, to their presence in the United States. So we were doing that kind of work, ensuring that families knew that they were safe, that we are here, and that they can always seek treatment regardless of their status, right? And then March the 3rd came and we had the tornado. And that was another, I would say, added hit to the immigrant community, because many of the neighborhoods that we know where our families are living were impacted by it. Also, we know many of those families were getting ready to fill out their census to make sure they're counted, and they were hit by it. Conexión Americas became a donation center immediately. And for me as a new leader at Conexión Americas, it was looking at the team and saying, how can we make sure that we become that, again, like that beacon of hope, but we are triaging resources to families? And then COVID-19. And so all those added layers are really impacting the constant negotiation of immigrant origin families. I'm going to give you a very specific example. Thursday, we have our food distribution in partnership with Second Harvest Food Bank. And we distribute about 200, 300 food boxes every week. And there was a man that was walking, and he said, oh, I heard that you're giving out food. I was out there helping, and I was like, okay, Juliana, mucho gusto, nice to meet you. And he was carrying a laptop, and I said, like a computer laptop. And I said, okay, I see that you're carrying something. And he said, yeah, I just walked to my son's school to pick up the laptop for MMPS. And I just walked here, for food. And that story has stayed with me since Thursday because it's a very specific example of how this man went to work, went to pick up a laptop, he walked, and then he walked to Conexion to Casa Safran to pick up the food. And then my question is, how are you going to get this food back to your house, right? Because you're going to need a ride. So that is giving you a snapshot of the realities we're seeing with our families, in addition to three main pieces that we're seeing: financial assistance for families that do not qualify for the CARES Act. And even though they pay taxes, they will not receive the check and the stimulus that many families are seeing. And issues related to food insecurity, again, is the constant negotiation of what do I do? Do I pay rent for April that is I'm already behind? Do I pay rent for May, or do I use that money to buy food? The data shows, as of this morning, from the applications that we received, that 75% of the families that are calling Conexión Americas need financial assistance to pay rent. And many of them are already behind on April's rent. The second one is utilities. And then the third one is food insecurity. So again, it's that constant negotiation families have to make when they're providing for their families. And it's very much real because many of them have to negotiate with their tenants, and many of these tenants are not cooperating and are behaving quite egregiously with many of the families we serve, threatening to evict them, even though we know there were policies in place. So what we're doing is capturing those stories, helping with financial assistance from the funds that we receive from United Way, from the COVID-19 Response Fund, and elevating these stories so that way we know what is happening with the communities that we serve, because they're part of this fabric. Many of them are the backbone of this community, the service industry, that do not have the privilege that you and I have of deciding if I go to the office or if I work from home.
All right, so let's break that down for individuals, because it's all very, very important. And I would say, as the Vice Mayor of Nashville and Davidson County, every person that lives in our city and county is important, and we have to figure out how to get through this all together. So let's talk about rental assistance so people are already behind, we know that. And they've stopped evictions and everything else, but obviously the courts are going to open back up. So what specifically are you hearing? And then are you getting some resources in to deal with that? And tell us, what is it that most concerns you, and maybe there's something we can do. Mm-hmm. So let's talk first about rental, and then we'll go to utilities, and then we'll go to food. Okay.
Mm-hmm. So we're seeing the shifts in needs, right? So the first wave in March was concerns of people losing their jobs, right? I have lost my job. I need to provide for my family, and then being able to pay rent, right? We have been communicating with individuals that they couldn't be evicted, they could not be kicked out of their home because we were in the middle of COVID-19 and the tornado. But now, as courts are opening, families are scared of what is going to happen with them. So my request to all of you, including elected officials and partners and private organizations, is to send resources to us so we can then deploy to the community in general, right? Because there's also the fear of stepping out and having that conversation with your tenant of not being able to pay, and the fear that they're going to report you or something else is going to happen. So that's the first one. The other piece that I would say is that, yes, we received funding from United Way, and we're extremely grateful. But the money at some point, of course, it is going to run out. So what can we do together as a community to make sure we take care of those individuals that will not make it, right? That will not receive financial assistance from Conexión Americas or other organizations that are going to be suffering. And Jim, the last piece that is important for me to say is what concerns me. Mm-hmm. As Juliana, as a citizen of the United States, I am concerned about the haves and the have-nots. I believe by Q3 or Q4, we're going to see those who were able to navigate homeschooling at home, those who learned how to use Zoom, those who had broadband, those families that under very difficult situations were able to provide an education for their kids. And then we go and go to the doctor, right? Get tested, have health insurance, where we have this pocket of this community that, as a result of all the institutional barriers, are going to be left behind even more as a result of COVID-19. That, as a human, as a philosophical question, is the thing that I worry the most.
Okay. Well, and I want to get into utilities and the food insecurity as well. And somebody just sent a message. I didn't see the whole thing, but it was about that it was illegal to evict. And I think at this point it is. I think the question is that going to continue? And I think that's what's concerning, is that at some point that's going to be lifted and people are behind on their rent right now. And so how do we deal with that? And I think that's a good question. I know that and usually Councilmember Allen is on, and she may be on right now. I know there were efforts being made to try to deal with that issue, but it's more of a, I think some of that is more of a state issue, but we have to figure out how to deal with that, because that should be very, very concerning to everyone. Let me, before I get to utilities, which is going to be somewhat of a similar concern, but you said something about people, you know, particularly if people are behind on their rent, they tend not to come out, or they tend to stay away from their landlord or whatever, and they're nervous about that. But overall, from a health standpoint, what are you seeing in terms of the immigrant population, the people that you know use the services of Conexion? What are you seeing in terms of, are they getting proper treatment? Are they getting the right equipment? Do they? And then there's a whole question that comes behind it, which I'll get to in a minute, which is about, are they getting the right information from Metro and from everybody else? But tell me a little bit about the health situation that you see.
Yeah, that's an excellent question. And first, the barriers we're seeing is, and I go back to the constant negotiation of making that phone call to the health line to get assessed and request information. The lines are in Spanish, but is that fear of many families not, even though we have said that documentation or status is not requested, and you all have done a really good job communicating, there is that fear that if I go to an assessment center, perhaps they are going to ask information, identifiers of me or my family, even if you have legal status in this country, right? I often joke, Jim, that when the tornado hit, and I live in Germantown, the first thing I grabbed was my blue passport. And that's me, Juliana, is my PTSD of an immigrant, right? That the first thing I took was my passport, right? So just to contextualize it. And what we're seeing is a negotiation, and families are starting to call, but many of them are not seeking assistance or care because they don't know how much treatment is going to cost. Because even though the assessment in theory is free,
Right.
treatment is not free. So even when they go to their provider, they're going to be receiving those bills after the fact. I am incredibly proud, like the work that Brian Hale and Neighborhood Health Clinic is doing in Salome is just fantastic. But on the other hand, it's again going to this disparities that we're seeing of those individuals that will not be treated. And I was looking at the zip codes, and we all saw the heat map, Jim, that the local administration released. And there is that correlation, right, of individuals and where we are seeing the new cases. In addition, I'm concerned about census, right? Many families, we all need to fill out our census. And if we don't do so, then we're going to see the repercussions of money and funding not coming in, and then the disparities at the school level. So my invitation to all of us is to keep advocating for equitable and better access to healthcare, expanding it for all, because this is a situation that, again, long term is going to have extremely negative impact, an impact for all of us. And let's not forget American-born children who were born in this beautiful state, that live with us, that are part of our community, and many of them will not will not have access to healthcare. So for us, is making sure that families continue to know that they need to seek assistance, that they were here. We have an entire section. We open it up on March 13th, an entire section on our website. Everything is in Spanish, working very closely with the local administration and the health department, informing, having videos in Spanish. But again, as an immigrant, it's difficult, right? Because we're so scared of what is going to happen if I do go and seek help.
Okay, so, again, we're just talking, we're having this conversation, it's in front of a number of people, but this very strong concern that, again, we're all in this thing together. And, one of the things that I know the mayor is focused on is, the spike in cases, trying to stabilize it, trying to see a downward trend, hospitalizations, number of people getting testing. So this is very important for everybody. Is there a way to alleviate that fear? It is very important for this city for everyone to feel like they can get tested, that there is treatment available, because, you see these large spikes. I mean, the state had a large spike the other day, and it may have been, I'm still trying to figure out if it was related to the prison numbers that they got, but there was a spike for over 1,000 cases between Thursday and Friday. We're trying to get on the downward side of this thing, and while we're opening up at the same time. So are there some things that you think that we could do from a Metro government standpoint, or from the people who are listening on this call, to try to eliminate that fear? We got to get people in and got to get them tested, and we got to get them treated if they're sick.
Yeah. The first piece that I would say that we have been doing, and again, incredibly proud of the work that Turk is doing in Salome Neighborhood Health Clinic, is making sure that information is in a language that is accessible to all families, regardless of their background. So if whatever identifiers are going to be asked, and if none are asked, to make sure that that is clear, available in all social media, and working in tangent with us to make sure that we continue. We've been doing that. But at the same time, when we as a state are letting people think that it's comfortable, okay, to go back to work, that's the part that also concerns me, because many of the families do not have the freedom or even the agency to decide they can stay home. And if the message is from the state that they can go home, we're open, and most of the families we work with are essential workers, they are potentially, of course, in danger of being impacted and testing, positive. But is this conflicting, I would say, pieces when the state is telling us, yes, we're opening, restaurants are opening, essential workers, like we have to go and do it, when our families do not have the choice to do so. So it's the constant negotiation. And if that is the case as it is right now, making sure that families have PPE so they can protect themselves. And that is an issue in our community because we know those resources are scarce. So for us collectively is to continue championing for policies that send a very clear message that identifiers are not asked, and then we need to keep an eye on the data, right? I'm concerned about people who are asymptomatic and now are testing positive, because many of our families will fall in that, under that category.
Okay. Well, let me mention, I know Councilmember Rutherford is on the phone, and Dr. Wright Pinson from Vanderbilt is on the call. And I think Dr. Pinson is going to be our guest next week. So we're glad you're both listening. So tell me, testing, very important. So, and Avi just posted something about, can you push testing? Where are the closest testing facilities for you and for your folks with Conexion? And do we need to try to expand those testing abilities to somewhere closer so people do feel comfortable?
Yes, to the latter question. The closest is Murfreesboro, Antioch, and then the Nissan Stadium. That's where families, the ones that have told us, have been going. And yes, expanding testing in as many sites as we possibly can, trusted sites.
Okay, all right, that's helpful to know. Okay, go back to, well, go back to the utilities question. So they're dealing with rental assistance and problems with rental payments. Utilities, the same thing. Right now, there's no cutoff fees, and people aren't supposed to be being cut off, I believe. But I assume if they're having trouble with rental assistance, they're also running into problems with utilities as well. You're hearing that as well.
Yeah, yeah.
Okay.
And it's one of the other in our percentages that the increases that we're seeing, right, of families negotiating. And then the other one, Jim, is having to cancel their internet service because it's the one in theory that you can live without. However, if you have children, is the one that you need the most so your kids can succeed in school.
Okay, so we're going to get to education in just a minute, but follow up, let's talk about food insecurity and what Conexion is doing now, because you have a commercial kitchen.
Mm-hmm.
And what are you seeing? Because I heard from the mayor's office that you all opened up, this may have been about a week and a half ago, and you had lines out the door with people trying to get food. And you told the story about the individual that you saw. But what are you seeing out there in terms of food insecurity, and what are you all being able to do about providing food overall?
So two pieces, I think, to your question. The first one is our partnership with Second Harvest Food Bank. Last Thursday, the day before yesterday, was our third round distributing food. And it was our first time doing so, right? And we were testing, and we worked with the local police department to manage traffic on Nolensville Pike, because as you can imagine, the number of people coming in continues to increase every single week. In addition, we're seeing beautiful angels and volunteers that are coming to help us, exercising social distance, and also bringing food so we can distribute along with diapers. So we are proud and grateful for those partnerships, but we see that our numbers continue to increase as many families are negotiating, right? If I get a food for this week, I will be okay. And also, I don't have to risk going to the grocery store. We also, Second Harvest has a partnership with Amazon, and we're sending a list of sensitive cases, many of the elderly who will not be able to come to Conexion, and Amazon is distributing that food to their houses, which has been, again, godsend, super wonderful. So it's new, this kind of work for us, and we're super grateful to Second Harvest Food Bank and the community that we've been able to systematize it. Now, our commercial kitchen, as you know, is our gym where we have 22 vendors that prepare food, many beautiful and wonderful caterers that have prepared food for many of us here in this call. And 90% of them had to stop their business in March because they didn't have the clientele and they were not having the demand, right, to continue producing food. We also heard from many of them who were having a difficult time accessing food to prepare produce because everything was closed, right, in March. The kitchen now has 2 or 3 vendors that are starting to come in and use the space. Carla opened, today is Saturday, yesterday, and she's selling food and she sold out. So there is that interest, that market, Little Gourmand as well, right, that they're opening and using the kitchen. Now, the challenge is for us institutionally is to make sure that we continue to exercise caution, right, and ensure that we follow CDC rules to make sure that we continue to protect our Casa Safran, our vendors, all of our individuals, as there's this promise, right, of them being able to sell food to the larger Nashville community.
Okay, so your commercial kitchen back open and your vendors are starting to come back, and it sounds like when we were talking before, and you just mentioned they were having trouble getting their the produce to make it into the food they were going to sell. That seems to be getting better at this point. Is that right?
Well, we're learning about it in real time this week because the kitchen was closed, right? And we can only have 2 or 3 vendors at a time. So even before, we had to, of course, limit the number of people. This week, as vendors are starting to open, we're hearing directly from them. We sent a survey on Thursday to hear what they need, what resources, access to produce, and also what do they need from all of us in the city so we can continue helping them and supporting them, because they're small business owners that use our commercial kitchen, so they don't have to use the kitchen at their own home.
Okay, so let me be specific on that. What do they need? If people are listening in and going like, I want to help on the food part, particularly for the vendors, and then overall for everyone else who is who is coming to Conexion Americas for help, for food, what do you need? What are the things that you need? What do the vendors need? And what do you need in terms of, I know you always need cash assistance. Is that it? Or do you need people to bring you food? And what is it? What do you need? What do you specifically need?
So as far as food, we're being very careful requesting additional food because we already have a system with Second Harvest Food Bank, and that system is working.
Okay.
What we need in addition to financial assistance and cash so we can provide families who do not qualify for any other assistance is also technical assistance, right? For many of us and many of you who have connections to local businesses that have survived the recession, that can provide technical assistance, TA, to small business owners on how to open in innovative ways to not only exercise social distance, I keep saying social justice, social distance, while also opening their business under a very limited, I would say, scope, because our priority is the safety of our vendors. And I would say also access to other vendors, other people in the city who are slowly opening very carefully to the larger community.
Do they have access to PPE, personal protective equipment? Do they have masks? Do they have access to, sanitizers and things like that? Are they okay there, or do they need that as well?
They will be needing that. PPE is something that we have a shortage of, right? Even for us, that in the local nonprofit community. And with the survey that we sent on Thursday, as we started seeing that the businesses are starting to open, and it's all online, right? That people order and they come and pick up their food. Hand sanitizers, all of those pieces, I'll be able to share with you, Jim, specific. I'm very careful with promoting things without asking our vendors before, because we just send the survey because things keep changing every single day. But PPE for sure. PPP, we know many of them requested. Many of them are still waiting to hear back. And many of them needed technical assistance on how to fill out the paperwork in all the forms, right? Because it was a quite difficult process. We have a partnership with the Regions Foundation where we're going to be able to help some vendors. But what we need right now is elevating their storings. Call them if you want to order food from our vendors. We can share more information with all of you, and ensuring that if you have and you know where we can get PPE to do, let us know. But again, this is just a small community, it's 22 of them, part of a larger initiative from the city, all of us, as we know, many of the people that we work with need us the most to advocate on their behalf.
Well, and I think we can, I think people on this call will help provide advocacy and can help hopefully provide some technical assistance. One of the things that I think I've learned, because it is so overwhelming at this point, you're trying to figure out, what do you do? What do you do in a situation like this? And I think one of the biggest issues for me is, you start trying to figure out, get a handle around it, and it's very, very difficult. So what I've started trying to do is you just do it the best you can. You pick a vendor and you try to go to them, and then you pick another vendor and you try to get other people to do the same thing. So I don't know if you have the information in front of you, but if, let's say, people on this call want to, they want to order food from one of your vendors. Mm-hmm. How do they find that? How do they do that?
Yeah, thank you. On our website, conexionamericas.org, 615-270-9252. And in our website, you're going to see our Mesa Comal website. The Mesa Comal is the name of our kitchen, our commercial kitchen. Well, we have updates of the vendors that are using the kitchen and started to do so this week.
Okay, so you can call that number, or you can go to the website and then you can order that way. Is that right?
Yes, and we are not, you order directly with the vendor. So if you are going to order food from Carla, let's say, you will be calling her directly so you can place your food.
Okay, all right. Very good.
Mm-hmm.
So Carla, very important to know that. I'm writing that down right now. Okay. All right, let me turn the conversation to something that should scare us all. And that is, you know, the whole thing is scary, but this is now you're talking about the internet connections and kids. You know, there was always concerns before that, you know, there are gaps in learning in different parts of our community. And we had this discussion with Christian Bugs a couple of weeks ago. She's from the school board, concerns about the widening gap between kids being able to get a good, solid education. Okay, so here we are in this period where kids are not in school, they're at home, and now you're telling me that, you know, I know that they're trying to do distance learning, but if parents if they can't afford the internet services, then what are the kids supposed to do? So talk about education. What are you seeing in terms of education? What are you hearing about that?
Yeah, going back to that story of that man that I met on Thursday,
Yeah.
right? Where the packets are distributing on Monday along with the meals, which is wonderful. That's 1 day a week. And then for families to have access to the laptops and the computers is another barrier. In addition of, I'm not a parent yet, but I know that we all want the best for our children. I know that parents want the best, but this is quite difficult to navigate when there's so many resources out there. And what we're hearing from our families is that they're using, and I put to my phone, WhatsApp and text messages with their teachers, which is wonderful, right? It just shows our teachers are just the rock stars, along with our healthcare providers, texting, asking questions about homework, equations, learning English. But that takes an additional step for kids and families and teachers to be constantly texting with their teachers, right? So it's making sure that all of us and you all come to organizations like Conexion Americas, where we know the students are struggling, we know the barriers, and we are advocating with the school district, with private and public organizations to make sure that those kids that do not have access to Wi-Fi, to internet, have access to that. And those that do not have access to a computer yet, like that dad that came to Conexion on Thursday, knows when and how to get a computer. And the other thing that I was going to say is it goes beyond having access to a laptop. And I think all of us, it was hard to learn how to use Zoom, right? It's kind of weird in my camera. What do I do? And now as a parent, all of those negotiations we have to take into account, right? So we are working closely with all of our partners to make sure that we hear directly from the families that need us and then deploying services. And I know someone wrote here about Bookem.
Yeah.
And again, it's ways that Conexion Americas, we're deploying services. But it's another gap that we're seeing in the system of the haves and the have-nots, and where we're going to see long-term. And my other piece is a push for direct instruction. I know it's hard for a teacher, of course, to teach, but 30, 40 minutes is important and vital right now, especially for our English learners that have an even harder time in the school system navigating a new language in a new culture. So I am concerned. I am really concerned. And I'm even more concerned, as I told you earlier, about quarter 3 and quarter 4. If we see another wave of COVID-19 and if we have to go back home, I hope that all of us learn our lessons and are better prepared for the fall, if indeed we see an increase of cases. But the stories are heartbreaking and also uplifting of that dad that came here. He walked because he wanted resources and we were able to support him. And he is not the only one.
All right. Well, you're getting into my next question. You were ahead of me when I was going to talk about, okay, the fall. But I want to go back. So I know Frida Player is on the call, a school board member. Brenda Wynn, our county clerk, is on the call as well. So thank you all for being there. So again, one of the things that we hope that this thing is helpful with, these conversations, first of all, you're great. You're telling us very, very important information that is very important for most everybody on the call to be familiar with and know what's going on. And from a standpoint of being in city government, we have to know this. So Councilman Rutherford, again, if Councilmember Allen has gotten on, this is important information for us to understand. I guess from a standpoint, again, and I keep pushing you on different things, on the educational piece, and I saw the Bookham comment as well. What do we do? How do we, if I were to, leave this call and go, okay, I need to be involved, and okay, so I can make a donation to Conexion Americas, but I also want to make sure that kids are getting those computers and that they have access through the internet, and they, how do we help you make this work? If Avi's on the call and he's going, like, he probably already has done something, but if he wants to do something specific to help, what's the best thing to do? And we can't all call you at the same time and go, okay, just tell me something. You've got an audience, and you may, people do watch this after. How do we help those kids?
Yeah.
What's the best thing to do?
So 2 pieces, right? Our programs are K-16. So we have a wide range, right? We see students from all aspects of the education system. We are here serving those students in the after school programs, right? We're doing everything is virtual and online. It's one of my now favorite projects when we have a reading initiative, when we invite elected officials, people to come and read, and we're launching it next week. So that's another one. If you want advocacy, is you telling these stories of these families that are going above and beyond to make sure that they have access to their resources needed to do their homework. Sharing these stories about connectivity and what does it mean to do your homework when you're logging into WhatsApp and your messages. Telling these stories is incredibly important. And the other piece is, if you want to contribute, if you want to help, if you want to tutor, let us know. Our education program is our team is working nonstop and is one of the pillars of Conexion Americas, where we can match people to help in different ways. And the last thing that I will say, Jim, is not all, we call it the pobrecito syndrome, like poor little things, like poor immigrants. It's not only about immigrant origin families. This is hard for all teachers, all students, regardless of where we come from. The challenge here is that there are additional barriers that make it even more difficult for us. So if you want to help, if you want to assist, let us know, let me know. And we can definitely match you and share more information about the work that we're doing. But I need you all to help me share the stories, because we're so proud of the work MMPS is doing and the district is doing, but the barriers we're seeing are so systemic that is a way of all of us coming together, making sure that we provide access to internet to those families that don't need it.
Right.
Food for families that don't need it. How to work with their tenant if they're going to be evicted, right? Because that ultimately translates into performance and academic performance. And that is my biggest fear for our society.
Okay. Well, and that's very helpful. I think, I remember when we were talking to Christian Bugs the other day, there were comments coming in about checking in with teachers. What do the teachers need? And again, this is such a big problem and a big issue. And government makes the mistake sometimes. I'm not saying it does it all the time, but it's like, we're going to give you this, and because we think we know what you need, and we don't. Because unless we ask teachers, unless we talk to the students, unless we talk to you, unless we talk to the people who are in need, we may not get it right. So we have to keep pushing to figure out, how do we get the advocacy, the resources, the funding, whatever it is, into the right place, so that we actually address the issues that are going on. Okay.
Yeah, and I just wanted to say something else. All of our programs are now remote, and our college success colleagues started an Instagram story to hear directly from youth. And that was another lesson for all of us, right? Of making sure that we capture the stories, the experiences from the families that we serve. That way we can adapt in a very nuanced sort of environment. So again, thank you for highlighting that, because we also want to hear from the students and the teachers that we support, so we can adapt and make sure that whenever we get a call, hey, we need food at this particular apartment complex, we say, okay, we have these boxes, let's deploy them. We have connections with La luz se prendió, the light came up. We have connections, then we'll take them to those families. That is what we are doing, and that's what we've been doing since March the 13th.
Okay. All right. That's very good. And I am more than happy to read to kids, and I'm also happy to be a tutor, assuming that no one says that I can't, or that people go, well, you can't get your nouns and your verbs together. All right. So the last question that I have, and then we'll see if anybody else has some questions. And I'm looking to see, can you share the stories with us so we can share them with others? Okay, so we'll get to that in just a second, because you already gave us one really interesting story. All right, so tell me about what you see as the learning curve through this. And then while we were talking, one of those little posts came up from the news feeds that said, doctors are concerned about the fall. All right, so in terms of what I've been concerned about and what I do during my day job is try to stay several steps ahead of this thing. So we heard from some folks in New York that were going through this, obviously in a much bigger way, that you got to stay 3 steps ahead. So we have already started trying to figure out for the fall, what do we do if it comes roaring back? It may hang around during the summer. It may deviate as it gets warmer. Maybe it picks up. But what would you tell all of us now from your standpoint? You're still trying to figure out this thing right now. And you've got the summer to go through. But if we can somehow pull it together and obviously get through this, and we will, but we're piecing it together right now. If we have some time to refocus before we get ready for the fall, what would you tell us to do from your standpoint about getting ready?
Yeah, well, the most important piece is, Jim, we need guidance from the experts related to COVID-19 and pandemics, right? Is philosophical questions of when do we open our building, for instance, right? I am following the data very closely and following what New York is doing and what Washington was doing, right? The state, I mean. And that is a piece of what keeps me up at night, if I can be quite honest, because we are preparing for July and August, and we have to make sure that we pivot our resources when there is a full, quote unquote, re-entry to the market, to the economy, helping families and individuals that need to apply for a job, right? How to write their resume, how to make sure that they take care of their families, and what happens if there is another increase in cases. My question and my plea to all of us is for us to have more information from the experts that are tracking these data very closely so they can guide nonprofits like Conexion, like many of my partners, so we can make educated and, I would say, data-driven decisions based on science to open whenever is realistic and appropriate. Because again, the fear and what we're seeing is this concern about being in a seasonal virus, and we don't know if in reality it's going to come back as it gets colder. And again, we thought that the most difficult thing was the tornado. Yesterday was the anniversary of the flood, and then we have a pandemic. So that's what we need, guidance from medical experts so we can engage in conversations to prepare for the worst while hoping for the best while doing the work of now. But to be completely honest, most of my time is focused on the medium long-term goals of the year to make sure that we make educated decisions, because as you know, Casa Safran is La Casa, is the home of many organizations that serve individuals that are quite very, very vulnerable.
Okay. So this is a tougher question for you. And that is, as you're looking for information from, health experts, do you feel like, well, I was going to ask you, do you feel like you're getting it from Metro? And you can answer that. And then how do we do a better job of keeping you engaged so that you can keep the folks that you provide services to engaged and informed as well? And if I know that the mayor's office is trying, I mean, obviously, there's a lot of people doing a lot of work on this, but we can always do a better job, or we can always try to do a better job. And the question is, what more can we be doing? Again, saying that everybody is involved in this. Our job is to try to protect every person that lives in this community. How can we do a better job? And it sounds like we need to be getting you more health-informed decisions so that you can make decisions as well.
And then navigating with what we're getting from the state and the federal level. I empathize with you at the local level because there are sometimes conflicting messages, right, that we're getting from different leaders in our society. So I want to say that we are I am, Juliana, very proud of the work that we've been doing with Mayor Cooper in getting and asking questions directly from us, what you need, they asking us, what are you hearing, what do you need, what information in families need. We can all do a better job making sure that we communicate in different languages, making sure that individuals know that they will be taken care of, at least for the assessment, regardless of their background. That is quite important. And I also keeping an eye of those individuals that are being left out because they don't have a car, because they don't have transportation. Our homeless population is another segment of our population that I worry a lot. And again, it's just having these very tough conversations. I think it's difficult because we don't have the answers, but coming to the table and really exchanging and dialogue of what we're hearing from different partners can help us get there.
Okay.
And I worry also because of the budget, right? I am concerned because this is a difficult time for the city, and on top of COVID-19, a lot of cuts and a lot of changes are going to be taking place and happening in our city. So I know these are difficult times, but I am also confident that we can continue working together to make sure that at least we send the right message to people to stay home if they can, and for employers to support their employees, and for us to do a better system, a better way, a better job with our healthcare system. I also worry again about those who have a precarious immigration status, right? Those individuals who will not get any assistance, right? Some cities have funds. Chicago released a fund for those populations and that those families. We're doing our best, but it's a collective effort because these are the people that we know, the people that come to our houses, the people that are building our beautiful city, and the people that have children that are going to school with our little ones. So we're in this together, and there's still a lot of work to do, but I'm very proud that we can have this honest conversations, an ongoing conversation about what's happening. And the heat maps have been very, very helpful.
So
more data.
There was a question about fear of detention, and I think the overall concern from the standpoint of people coming out. So you talked a little bit about that before, but that still remains, I assume. Is that driving, again, some of the people being fearful of coming out? You said it was with testing and other things. They're scared of showing up. So has the overall situation quieted down? Again, you know, this is one of those national issues that we keep talking about, but this thing, COVID-19, and I'll stress this very emphatically, doesn't care who you are, how much money you have, where you're from. It doesn't care. It impacts everyone. And so if it impacts, if it impacts people and then they don't get tested and then they spread it, it spreads around, and it makes it so much more difficult. So this fear of, ICE and being picked up and detention and other things, quieted down or still out there, I guess is the question.
It has quieted down because we've been home, right? Yeah. And then of course there are policies in place, but the negotiation is going to work, going to get tested. And again, I'm proud of the work that we've been doing, championing along with other nonprofits to make sure that fear is not what's driving the decision making, that people feel that they can go and be taken care of if they are at risk.
Okay. All right. I think we have time for maybe one more thing, and somebody had sent something in and they wanted to hear another story, I believe. And then when you end, you need to tell everybody how to get in touch with, if they want to make a donation, if they want to find out what they can do individually, if they want to teach, if they, I think there's a retired librarian who just put a chat on there. How do they, tell us another story, and then end up with how we find, how do we get information to you that we want to help, either through donations or volunteering. Okay.
Yeah, so I'm gonna tell two quick stories. First one, yesterday when I came again to the office, and there was a mom that came to Conexion. She heard about the food, and then she came with her 3 little ones. She wanted to come to the clinic, and then we were able immediately to give her neighborhood health clinic so that she could be seen and taken care of, because apparently she got tested and she had not received her results, right? So it was an immediate way of, by her coming here, and by the grace of God that I was here on Friday morning, like I was able to help her out and give her a very tangible resource, while also keeping in mind that she was with her little ones and there was a fear that perhaps she was positive, right? So again, negotiations that have to take place. And then a good field story, right? We had our largest cafecito, our fundraiser last Friday, April 24th. I was concerned because it was the first time we do something online. And I was also really looking forward to meeting all of you. And we surpassed our goal by individual donations, individuals that come to our program, English learners that have used Mesa Comal, our kitchen, parents of kids that we've helped, families that have filed their taxes with us, and dollar por dollar, 10, 20, 30, they took us to our goal. So what a beautiful way of celebrating the immigrant resilient spirit of our community and our city as well, that we're all in this together, championing. And to me, when I went home on Friday, I just couldn't believe it, right? That we all came together, believing in an organization like ours and the work that we continue to do by individual donations. To me, what a beautiful story of our city and our community.
Very good. Very good. All right. So we're going to end by telling you, by you telling us, all right, so if we need to, how do we find you? How do we help? If people want to be helpful, what's the best way to do it? And I assume it's through a website and phone numbers and whatever. So go ahead.
Yeah. So with me, Juliana, conexionamericas.org. Fácil, that one is easy. You can email me. Our phone number, 615-270-9252, and also conexionamericas.org to find resources, ways to partner with us, technical assistance, to donate and to learn more about our work. But again, my name is Juliana, in Juliana Conexion Americas. I'm always here to help and answer questions. And I want to hear from all of you as well. I think now is when we need to have these dialogues and learn from each other, because this is definitely a new territory for all of us, and of course for me.
Juliana, thank you. You've been great. I hope everybody's enjoyed this. We have one next week with Dr. Wright Henson from Vanderbilt. Should be pretty interesting. Oh, somebody said, are you participating in the big payback?
Yes. Yes.
That would be a yes. Yes.
Yes.
Okay. All right. Thank you for doing this. We appreciate it. You stay safe. I hope your finger feels better. That thing with the big bandage on. There it is. Wait a minute. It was on a different finger before. There you go. All right. Just keep moving it around. Be careful of splinters. But no, stay safe. Be healthy. And thank you for doing this. All right. Thanks, everybody. Signing off.